Good day, and welcome to this session of the Gross Anatomy video podcast series. As always, this is Dr. Stuart Inglis. In the previous session, we looked at the abdominal viscera. Today, we're going to take the viscera away and look at the posterior abdominal wall. First part of the session is we're actually going to be going back into the viscera by looking at the descending aorta and the principal branches that come off to supply blood flow to this region. We could have covered it the previous day, but I figure you're probably up past midnight watching the videos anyway, so I thought we would leave it for today. Just a quick review as we go into this. Remember previously I talked about the idea of the developing embryo, and we said that the alimentary canal, which develops from the mouth to the developing rectum, is supplied by three separate arteries, which define the different regions of the alimentary canal. The foregut, supplied by the celiac trunk, the midgut, supplied by the superior mesenteric artery, and the hindgut, which is supplied by the inferior mesenteric artery. Today, we're going to look at each of these arteries in turn and identify the principal branches coming off of each. So let's start with the celiac trunk. We see it here in the middle. This is what supplies the esophagus, stomach, duodenum, and a number of the accessory organs of digestion. First branch that we see, there's three principal branches to identify. And probably the most straightforward is the left gastric artery. So this is the one that's going to come off, veer to the left as the name implies, and it's going to supply branches to the lesser curvature of the stomach, as well as some branches which will travel in a recurrent fashion up to supply the distal portion of the esophagus. Next, off of the celiac trunk is the splenic artery. This is a very characteristic artery. It has a very tortuous route and coils and curls, sort of resembling a pig's tail as it runs. As you can imagine from the name, this is going to run and supply the spleen. But as it does, it is going to give off some accessory branches to the pancreas. So these we identify as pancreatic arteries. And as it approaches the hilum of the spleen, it will give off a number of smaller branches that will supply the fundus of the stomach along the greater curvature. So these are known as our short gastric arteries. And finally, we have one long branch which will travel the length of the greater curvature, which is known as the left gastroepiploic artery. So these are the principal branches which come off of the splenic artery. Next, we have the common hepatic artery. So this is the third branch to come off the celiac trunk, and this is going to move to the right of the body, and it's going to be the principal blood supply for the liver. As it runs, similar to what we saw with the splenic artery, we do see some additional branches that we have to be conscientious of. So first, we're going to see a branch that's going to move up to the liver. This is known as the hepatic artery proper, which will supply the actual liver itself. As it runs, it will split into left and right hepatic arteries, and typically the right will give off a branch which will then run to the gallbladder, so this will be known as the cystic artery. The other portion of the common hepatic is going to run down, and it's going to supply the stomach, the pancreas, and the duodenum. So first we have what's known as the right gastric artery, which is coming off and supplying the right portion of the lesser curvature of the stomach. Next, boy, this one's a mouthful. We see this branch that is going to come down to supply the stomach, but also the duodenum. So this is known as the gastroduodenal artery. And this runs right in the intersection of the stomach and the duodenum, around the level of the pyloric sphincter, hence the name. It will then split and will have a division that will run anterior to the pancreas and a division that will run posterior to the pancreas. And so consequently, we call these the superior pancreaticoduodenal arteries. And we have an anterior and a posterior superior pancreaticoduodenal artery seen here. One in front, one in behind. Now, as you can tell by the name, we said superior pancreaticoduodenal arteries, so obviously we're also going to have an inferior pancreaticoduodenal artery, but we're not going to identify that until we get to the superior mesenteric artery. Finally, note the presence of the right gastroepiploic artery. So we saw the left gastroepiploic artery coming off of the splenic artery, and epiploic is another name for omentum, so you can understand where the name comes from, being that it's right in between the stomach and the greater omentum. So here's the right gastroepiploic artery coming off of the gastroduodenal artery that we saw, which is going to supply branches once again to the greater curvature as well as to the greater omentum, and is going to anastomose with the left gastroepiploic artery off of the splenic. Okay, that takes care of the celiac trunk, which is really the most complex with all the extensive branching that we are able to see here. This brings us to the superior mesenteric artery. Now, a minute ago, we talked about the anterior and posterior superior pancreaticoduodenal arteries, and so now we encounter the anterior and posterior inferior pancreaticoduodenal arteries. So they will once again travel on the anterior and posterior surface of the pancreas to anastomose with the superior divisions that came off of the celiac trunk. Now, as the superior mesenteric artery continues down, it will move from this middle superomedial position and will run to the right and infralaterally to the junction between the ileum and the cecum, which is part of the large intestine. And you will notice a number of extensive branches given off in this area. Now, it'd be really annoying if we gave all of these different names, and what would we name them? You could maybe like Kevin and Stu and Bob and all the other minions that we see in the Minions movie. Fortunately, you don't have to worry about that. They're all just called jejunal and ileal arteries, and it's once again very difficult to figure out the divisions between them as it is to figure out exactly where the jejunum stops and the ileum begins. But notice, as we talked about in the previous lesson, the jejunum has less extensive arcades and longer vasorecta, and then when we get to the ileum, more extensive arcades and shorter vasorecta. But beyond that, you just have to know these as jejunal and ileo arteries. There is an additional branch that we do see, and this one's a bit more distinct, and it basically makes a beeline towards the junction between the ileum and the cecum. And so this is our ileocecal artery. And part of the reason for its importance is because of a sub-branch which will come off to supply the vermiform appendix. And so that's your appendicular artery. It's important in that if you're having an appendectomy performed, this is an artery that you have to localize and clamp and ligate prior to removal of the appendix, or else you're going to start bleeding like crazy. Next, a little bit further up, we have what's known as the right colic artery. So very simply, this is the artery that supplies the right side or ascending colon. Next off the list, and cut in this situation because we had to remove the transverse colon, we see this little segment here that's been removed in this diagram. That's going to be the middle colic artery, which is going to go directly to the transverse colon and supply that portion of the large intestine. And that does it for the superior mesenteric artery. Third on the list is the inferior mesenteric artery. So this view from Netters gives us a good view of both the superior mesenteric, which we saw. Most of the jejunal and ileo branches have been cut and the small intestine removed so that we can get a better view of the descending aorta and the inferior mesenteric artery. And once again, we can see our ileocolic artery giving off this colic branch and ileo branch. You'd have the appendicular artery coming down from here. We can also see the right colic coming across to supply the ascending colon. And here we get a better view of the middle colic artery and what it would look like supplying the transverse colon. That will now bring us to the inferior mesenteric artery, and the first thing to identify is what we call this marginal artery. So this represents the anastomosis between the superior and inferior mesenteric arteries. The principal branch off the inferior mesenteric artery, first we see the left colic. So similar to what we saw with the right colic, it's just going to run and supply, in this case, the descending colon. And then we have several branches which will project down and are all just referred to as the sigmoid arteries because of the fact that they supply the sigmoid colon. And then finally, our terminal branch off the inferior mesenteric is the superior rectal artery. You do have a middle and inferior rectal artery. The middle is one that's found in the pelvic cavity, which we don't get a chance to really identify in this course. And then the inferiors are actually off of the internal pudendal artery, which you identified in the previous unit. Time to turn our attention to the venous drainage from this region. So we had our superior and inferior mesenteric arteries, which supplied the midgut and the hindgut region. Similarly, we have the superior and inferior mesenteric veins, which will drain the same areas. What's slightly different here is we don't have what we call a celiac vein, but we do have this splenic vein. And the typical orientation that we see is the inferior mesenteric vein draining into the splenic vein, and then the splenic vein moving across the aorta to drain into the superior mesenteric vein. The point at which the splenic and superior mesenteric veins fuse creates this portal vein. Now, we described the importance of the portal vein in the previous session. This collects all the blood from the abdominal tract, sends it to the liver so that the liver will be able to have first pass of all the nutrients in the body. So just a reminder of that orientation. And with that, that will conclude this session on the vasculature to the abdominal cavity. When we come back after the break, we'll actually look at the proper posterior abdominal wall, the muscles, the nerves associated, and take a very brief look at the gross anatomical structure of the kidneys. See you after the break.